Welcome back to the Hashimoto's Nutrition RX. Today we're diving into a topic that can be a game changer for many of you: how medical nutrition therapy, or simply nutrition for Hashimoto's, differs between Hashimoto's and hypothyroidism. If you've ever been confused about what you should be eating to support your thyroid health, this episode is for you. I will break down the key differences in nutrition strategies for managing these two conditions. We'll talk about the specific nutrients that can support your thyroid, how to address the autoimmune component of Hashimoto's, and what dietary changes might help reduce inflammation and improve your symptoms. By the end of this episode, you will have a clear understanding of how to tailor your diet to your specific needs, whether you're dealing with general hypothyroidism or the autoimmune challenges of Hashimoto's. You might be wondering, does diet really change depending on whether I have Hashimoto's or just hypothyroidism? While there are some overlapping dietary principles, there are key differences in how we approach nutrition for each condition. Let's break this down in a simple, straightforward way so you can better understand how your diet can support your Hashimoto's or simple hypothyroidism. Now, if you're confused about the terms Hashimoto's and hypothyroidism, make sure you check out my video or podcast episode titled Hashimoto's versus hyperthyroidism. What's the difference? Where I explain the fundamental differences between these two conditions. First, let's talk about medical nutrition therapy, or MNT. MNT is a specialized, evidence-based approach to using nutrition to manage and treat various health conditions. It is more than just giving general dietary advice. It involves a detailed assessment of person's medical history, nutritional status, lifestyle, and specific health needs. The goal is to create a tailored nutrition plan that helps improve or manage specific medical condition, ranging from chronic illnesses like diabetes and heart disease to autoimmune disorders like Hashimoto thyroiditis. As a licensed registered dietitian, I implement medical nutrition therapy in treating Hashimoto's and hypothyroidism. A quick side note: only licensed registered dietitian can provide medical nutrition therapy because we have the specialized training and credentials to assess, diagnose, and create individualized nutrition plans that safely and effectively address complex medical conditions like Hashimoto's. When it comes to thyroid health, what you eat can significantly impact how you feel and how well your thyroid functions. Now let's dive into hypothyroidism and how we support the thyroid with nutrition when the hypothyroidism is not caused by Hashimoto. The primary goal here is to provide the thyroid with the nutrients it needs to function optimally. Here are some key areas of focus. Number one, nutrient support. Essential vitamins and minerals include iodine. The thyroid gland uses iodine to make thyroid hormones. If you have hypothyroidism due to iodine deficiency, though this is less common in countries where iodinized salt is used, it is important to include iodine-rich foods like seaweed, fish, dairy product, and iodinized salt. However, balance is the key. Too much iodine can actually exacerbate thyroid issues, so supplementation should be approached very cautiously. Second mineral to pay attention to is selenium. Selenium is crucial for converting T4, inactive thyroid hormone, to T3, which is active thyroid hormone. It also has antioxidant properties that help protect the thyroid gland. Include selenium-rich foods like Brazil nuts. Just about 1 or 2 nuts per day should be enough. Sunflower seeds, tuna, and mushrooms in your diet. A third mineral to pay attention to is zinc. Zinc plays a role in thyroid hormone production and conversion. Include zinc-rich foods like shellfish, legumes, seeds, and nuts. Iron is another mineral to pay attention to. Iron deficiency can impair thyroid hormone production. If iron levels are low, include foods like lean meats, leafy greens, lentils, and iron-fortified cereals. Pairing iron-rich foods with vitamin C-rich foods like citrus fruits can enhance absorption. Next up is vitamin D. While not directly involved in thyroid hormone hormone production. Vitamin D is crucial for immune health. Low levels of vitamin D are often seen in those with thyroid disorders, so ensuring adequate sunlight exposure and including foods like fatty fish and fortified foods can be beneficial. Now, let's talk about dietary patterns and lifestyle that are beneficial for hypothyroidism that is not caused by Hashimoto's. Number one, a balanced diet. A diet rich in whole foods, lean protein, healthy fats, and fiber rich carbohydrates support overall health and can help manage symptoms like weight gain and fatigue, often associated with hypothyroidism. Number two, regular eating schedule. Hypothyroidism can slow down metabolism, so it's helpful to maintain a regular eating schedule to support steady energy levels. When it comes to goitrogens, food like broccoli, cauliflower, and soy contain compounds called goitrogens, which can interfere with thyroid hormone production, particularly when iodine intake is low. This is a very important nuance. If you have low iodine levels or low iodine intake, then a very large amount of goitrogenic foods may cause problems. However, cooking these foods reduces their goitrogenic activity, so they don't need to be avoided entirely. Final nutrition approach for hypothyroidism. Guys, please avoid excessive dietary restrictions. Since hypothyroidism isn't driven by an autoimmune response, unless, of course, it is caused by Hashimoto's, there is usually no need for strict elimination diets. Now, switching gears, when it comes to Hashimoto's, the focus shifts a bit. Here, the primary goal is not only to support the thyroid with key nutrients, but also to modulate the autoimmune response and reduce inflammation. Let's explore what this looks like. First up is selenium. Just like with hypothyroidism, selenium plays a vital role in thyroid health. However, in Hashimoto's, selenium is even more crucial because it helps lower thyroid peroxide TPO antibodies, which are often elevated in Hashimoto's. Brazil nuts, again, are an excellent source, but make sure not to overdo it. Just 1 or 2 nuts per day provide sufficient amount. Second is zinc. Zinc is essential for immune function and may help reduce antibody levels. Include zinc-rich foods like pumpkin seeds, chickpeas, and beef. Next one is vitamin D. Low vitamin D levels are common in autoimmune disease, including Hashimoto's. Vitamin D helps modulate the immune system. Spend time in the sun. Include fatty fish and fortified foods in your diet. And consider supplements if needed, but only after checking your levels with your healthcare providers. Next one is iron. Similar to general hypothyroidism, maintaining optimal iron level is essential for thyroid function, especially since anemia is so common in Hashimoto's patients. Focus on iron-rich foods and support absorption with vitamin C. Now let's tackle a big topic, diets that may help Hashimoto's and immune system. First up is gluten-free diet. Many people with Hashimoto's find that a gluten-free diet helps reduce symptoms. This may be because gluten can trigger an autoimmune response in some individuals. Research has shown that some people with Hashimoto's have a higher risk of celiac disease, so it can be worth exploring gluten-free diet to see if symptoms improve. Having said that, I don't think everyone with Hashimoto's needs to avoid gluten. One of the strongest studies we have is a 12-month randomized control trial of 62 women with Hashimoto's showed no significant differences in thyroid function or antibody levels between those on the gluten-free diet and those on the usual normal American diet. However, there was a reduction in TSH in the gluten-free group, so it's worth to try if you plan your diet carefully. The second diet I want to talk about is a dairy-free. There is no medical indication that people with Hashimoto's should avoid dairy. Of course, if you're lactose intolerant, then choosing lactose-free dairy is a smart move. Having said that, some people find that avoiding dairy can reduce inflammation and improve their gut health. Dairy proteins like casein can sometimes trigger an immune response, so a trial period without dairy may help you identify if it's a trigger for you. Again, I don't advise following diet across the board. It's all case by case. One more thing to consider: dairy does interfere with thyroid medication, so wait at least 4 hours between administering medication and eating dairy. Lastly, I want to talk about AIP diet, autoimmune protocol diet. The AIP diet is a more restrictive form of the paleo diet designed to reduce inflammation and support gut health. It involves eliminating foods that are potential immune system triggers, such as grains, legumes, nightshades, nuts, seeds, eggs, and processed foods for a very short period before slowly reintroducing them to identify food sensitivities. If you're thinking about doing AIP diet for a very short period of time, please plan it carefully and don't stay on it for too long, because it will cause nutrient deficiencies that will lead to side effects like constipation, hair loss, bloating, and you will destroy your gut health, because AIP diet eliminates a lot of fiber-rich foods. If you're trying to improve your Hashimoto's by modulating your immune system, focus on gut health. Since 70% of the immune system is in the gut, supporting a healthy gut microbiome is key in managing Hashimoto's. Include prebiotic foods like garlic, onion, and asparagus, and probiotic foods like sauerkraut, kimchi, and yogurt, even dairy-free yogurt, to support your gut health. Now let's talk about lifestyle and stress management. Chronic stress can exacerbate autoimmune activity, so managing stress is crucial. Incorporating stress reducing activities like yoga, meditation, or even simple breathing exercises into your daily routine. Gentle, regular exercise can help reduce inflammation and support immune function. However, avoid overexercising, which can sometimes trigger autoimmune flares. And finally, one of the most important lifestyle approaches you can implement to modulate your immune system and improve Hashimoto's is aiming for 7 to 9 hours of quality sleep per night to support hormone regulations and immune health. In the final part of this episode, I want to talk about finding what works for you. One thing to keep in mind: there is no one size fit all approach. Your body is unique, and what works for someone else might not work for you. Here are some steps you can take to find the best nutritional approach for your thyroid health. First, work with a professional, especially if you have Hashimoto's. Working with a registered dietitian or healthcare provider experienced in thyroid health can help you navigate dietary changes safely and effectively. Number two, track your symptoms. Keep a food and symptoms diary to identify patterns. This can help you pinpoint foods that might be triggering symptoms or making you feel worse. Number three, gradual changes. If you're considering an elimination diet like AIP, start gradually. Suddenly cutting out many food groups can be overwhelming. Focus on one change at a time to see how it affects you. Number four, listen to your body. Pay attention to how you feel after eating certain foods. Your body often gives you signals about what it needs and what might not be working for you. So, to sum it all up, medical nutrition therapy for hypothyroidism focuses on providing the thyroid with the nutrients it needs and maintaining overall metabolic health. When Hashimoto's is in the picture, we take it a little step further by addressing the autoimmune aspect, reducing inflammation, and supporting gut health. The dietary approach for Hashimoto's often involves more targeted interventions like gluten-free or AIP diets. Remember, nutrition is a powerful tool in managing thyroid health, but it's just one piece of a puzzle. Lifestyle factors like stress, sleep, and physical activity also play critical roles. Whether you're managing hypothyroidism or Hashimoto's, adopting a holistic approach that considers both your nutritional needs and lifestyle factors can make a big difference in how you feel. If you're feeling overwhelmed by all of this information or unsure where to start, I'm here to help. Together, we can create a personalized plan that fits your unique needs and helps you take control of your thyroid health. That is it for today's episode. I hope this deep dive into medical nutrition therapy for Hashimoto's and hypothyroidism has provided you with the clarity and knowledge to take actionable steps towards better thyroid health. Remember, the right nutrition and lifestyle changes can make a significant difference. If you have any questions or need personalized guidance, feel free to reach out. Until next time, take care of your thyroid and take care of yourself.